Hey, Dad. Mum said I'd find you down here. What are you doing?
Oh, just sitting. Not thinking too clearly at the moment.
Well, I was going to go visit my cousins. Anything you want me to pass on to Uncle Todd and Auntie Ruby?
Nah, I'll just sit here for a while. The ocean, the breeze, the land. Reminds me of home. Helps me to think about things. Makes me feel good in here. I don't feel so alone.
Hey, Dad, you're not alone. You've got your family.
Yeah, I know, son. But I can feel the ancestors of the land here. Helps me to think clearly. You go and visit your cousins. I'll be all right. I'll just sit here for a while.
Well, you call me if you need me, eh?
There are a number of tests that you might need to have if doctors suspect lung cancer. The GP will order a chest X-ray to see a picture of your lungs. This is a very simple test and can usually be done in your community. The GP might also ask you to give a sample of your sputum, thick spit, to see if there is an infection or other abnormal cells in it. If your chest X-ray is abnormal, the GP will then send you for a CT scan. A CT scan can show more detailed pictures of your lungs and smaller cancers that are not visible on chest X-ray. You might have to go to a hospital outside your community to have this done. A CT scan takes about 10 minutes. You'll need to lie flat on a table while the CT scanner, which is shaped like a donut, rotates around you. If your CT scan is abnormal, your GP will refer you to a lung specialist who will decide what further tests you require to see if you have lung cancer. These tests may include a bronchoscopy, biopsy and CT PET. A bronchoscopy involves a flexible tube with a camera on the end being passed down through your air tube to allow the doctor to look directly into your air passages and lungs. For this procedure, a doctor will give you some medicine to relax you and make you sleepy. Your specialist might explain that you may also need a biopsy to get samples of abnormal lung tissue. You can have a biopsy during the bronchoscopy, or you might need another type of procedure called a CT-FNA. A CT-FNA involves a very fine needle being passed through the skin of your chest and into the area where the abnormal tissue or lump is seen. The specialist will decide which procedure you require and will explain to you what is involved. The sample of lung tissue taken from the biopsy will be sent to a pathologist for testing. The pathologist will look at the sample of tissue under a microscope to see whether there are any cancer cells. A CT PET scan is a special scan to see if a lump is likely cancer or if the cancer has spread in your body. You will receive an injection of a sugar substance called FDG. This procedure will be explained in more detail by the doctor. The tests mentioned are the most common ones to diagnose lung cancer, but you might have others. The lung specialist will work out the most appropriate combination of tests. Certain tests like bronchoscopies and CT PET are available only in large hospitals, so you might have to leave your community and stay overnight. Usually breathing tests are done to see how strong your lungs are. Based on the diagnostic test results, your lung specialist will work out if you have cancer, the type of cancer, if it has spread, and work out the best option for your treatment.